Hello viewers, in today's video I am describing about the anatomy of human skull. The human skull is made up of different bones that consist of 8 cranial bones, 14 facial bones, 6 ear bones and 1 hyoid bone. Now we are seeing the anterior view of skull, that is called the norma frontalis. The bones which are contributing in the anterior view of the skull are frontal, nasal, maxillary, lacrimal, diagomatic, palatine and a group of cartilage called the nasal cartilages. In this animation, for better view and understanding the individual bones, the bones are being separated out. Now we are focusing on the frontal bone, which covers the forehead area of the skull and the uppermost edge of the eye orbit. The lacrimal bone is located in the inner aspect of the eye orbit, whereas the ethmoidal bone, a spongy bone, forms. Here one more structure is being seen, which is the anterior part of the frontal bone called the glabella. Below to it you are able to see the orbit of the eyeball, and further down you are able to see the bones maxilla and mandible. Maxilla bone is the second largest bone of the face. The two maxilla form whole of the upper jaw. All maxillary teeth, central incisor, lateral incisor, canine, first and second premolars and molars are here attached to the maxilla. You are able to see the alveolar process of the maxilla. Also appreciate the pair of nasal bones which form the root of the nose. The bone forming the cheek is known as the zygomatic bone, and it is a diamond-shaped irregular bone that protrudes laterally and forms the prominence of the cheeks. The zygomatic bone also forms a portion of the lateral wall of the orbit, floor of the orbit, and some portions of the temporal fossa and infratemporal fossa. The last of the facial bone comprises of mandible or lower jaw. It is the largest and the strongest bone of the face. It consists of body and ramus. The processes of mandible are the coronal process, where temporalis muscle is inserted, and other is the condyle process, which articulates with the disc of temporomandibular joint. It holds the lower teeth in place and assists in mastication and forms the lower jaw line. Now we are able to see the lateral view of the skull, in which we are able to see the zygomatic bone anteriorly and squamous part of the temporal bone posteriorly. We can also appreciate the lateral surface of mandible, which are seen as ramus and body of the mandible. Now we see the posterior view of skull. In the posterior view, we visualize the parietal bone and occipital bone. The two parietal bones are joined by the sagittal suture, while the parietal and occipital bones are joined by the lambdoid suture. In this view, you can also appreciate sphenoid bone and the greater wing of sphenoid. The sphenoid bone resembles a bat with outstretched wings. It has a body, two lesser wings, two greater wings, and two pterygoid processes. We can also visualize the parts of the temporal bone in this view, that are the squamous part of the temporal bone, the base of the skull has a very important foramen, the jugular foramen. It is unique because it gives transmission to 3 cranial nerves. The foramen is situated between the anterior margin of jugular process of occipital bone and posterior margin of petrous part of temporal bone. The structures passing from the jugular foramen are inferior petrosal sinus, sigmoid sinus, and the 9th, 10th and 11th cranial nerves, that are the glossopharyngeal, vagus and accessory cranial nerve respectively. The foramen magnum, which is present in the base of the skull, is the largest foramen of the skull. It is divided into anterior ligamentous compartment and posterior vascular compartment. Within the anterior ligamentous compartment, you can see the apical ligaments of dens, superior longitudinal bend, and in the posterior neurovascular compartment, you can see the lower part of the medulla oblongata, spinal root of SC nerve, and meningeal branch of upper cervical nerve, anterior posterior spinal arteries, the tectorial membrane, and the alar ligament. In the norma basilis, we can also see projections which are the external occipital protuberance, and if we trace anteriorly till the foramen magnum, there is a median crest elevation of. Here in this view, you can see in the upper margin of the parietal bone, there is a shallow groove known as the superior sagittal sinus groove. So viewers, this was all about the anatomy of the skull. In one of my later videos, I will be posting a detailed description of the In one of my later videos, I will be posting a detailed description of the whole human skeleton to clear the most minute points of the human skull.